Hello, my name is Dr. Hoda Amer, and we're going through the steps for the Rose Rapid On-Site Evaluation in an EUS or ERCP setting. The first thing you want to make sure you have is your basket. Your basket should have at least a slide holder, some slides, the RPMI bottle holders, and before you go there, you want to make sure that you have enough RPMI that are at least filled 3 bottles, filled halfway, and to take an extra empty one. Remember to always label your RPMI bottles with the expiry date. If you open a new bottle, label the bottle with the date you just opened, the date that you opened it, and these are in accordance to the CLIA laws. In the EUS and ERCP, you want to remember to request the patient's medical labels and make sure that you confirm the patient's name, MRN number, and everything else. Also, make sure that someone has checked the patient's arm label, hand label to make sure or wristband to make sure that you're in the right place. You want to put the labels on the RPMI and set up your station by plugging in the blow dryer, opening the microscope, opening the staining containers. Fill one of the containers with water. You want to label at least 6 slides with the patient's name and date of birth as 2 patient identifiers. You also want to label them consecutively depending on how you plan on staining them, whether diff quick, all of them will be diff quick, or some of them will be pap smear stained, or H&E depending on your institution. They will give you the scope or the stylet, and you want to put 1 drop of blood on the slide, using the other slide to keep the blood from spraying everywhere. You want to smear the slides gently. Learning how to smear slides is a skill. You can practice this before actually doing this on site. You want to remove any blood clots and put them in the RPMI. Usually, you will want to, someone will flush out the stylet into the rest of the RPMI with either saline or air. Sometimes you will do it yourself, depending where you are. Your setup might look something like this. You have the blow dryer to dry the slides quickly. You have the staining station. You have the water to rinse out the slides. Depending where you work, you will follow the procedure for the hemodiff. You want to tell them if it's adequate or not. If you're not sure, ask for help. If it's borderline, just say it's not adequate. Situations that are adequate include tumor, granulomas, abundant mucin in a cystic mucinous tumor with elevated tumor markers, granular debris, neutrophils, macrophages, yellow bile pigment, fat necrosis, and a chocolate-colored aspirate in a patient without elevated tumor markers, and a compatible clinical impression of a pseudocyst, that's also adequate. Marked mixed inflammation, fibrostroma, calcification, fat necrosis crystals in a patient with a history of pancreatitis, compatible with the clinical impression, that can be adequate as well. If there's numerous lymphocytes in a query lymph node or suspicious for lymphoma, that's adequate as well. You want to communicate with the clinician and to look at the patient's file yourself if necessary. So if there's lots of tumor in an adenocarcinoma, that's adequate. What about a neuroendocrine tumor? They're much more uniform, but they're large in number and make like these sheets. Spindle cells, common. Neuroendocrine or GIST. Let's go through the adequate first, and then we can go back and go through non-adequate. So adequate. Numerous lymphocytes, a lymph node, or if it's suspicious for lymphoma. How about abundant clean mucin in cystic mucinous tumor with, like we said, elevated tumor markers? Calcification, necrosis, and like we said, a chocolate aspirate, and a clinical impression of a pseudocyst. Marked mixed inflammation, fibrostroma, calcification, fat necrosis crystals with a history of pancreatitis gives a clinical impression of pancreatitis. Okay? Now let's go back and see when is it not adequate. So, GI epithelium, benign pancreatic ductal or Essner cells. So here's some epithelium. Here's some more. Here's some benign cells. Dirty mucin is GI contaminant. What if you find only a rare cluster of tumors? So that's not enough for diagnosis either. How about only a rare lymphocyte? Not enough for a lymph node or even to send to flow. Or a bunch of necrotic debris if you don't have any viable tumor. You want to record your findings onto the rec form, and it's okay to call for help. You will often need to give a preliminary diagnosis in the ERCP if they want to put a permanent stent. It's always good to have a second opinion on that since it's a permanent stent, if you're not sure, or if the clinician wants a second opinion. For lymphoma, you want to follow the procedures in your institution of where you may need to divide the sample or put the order in yourself. And for evening cases or cases that you plan to do pap smear at a later time, it's good to rehydrate the slides, and you can listen to that about that on a different lecture. So that's all. Good luck to you. And if you have any questions or comments, please feel free to reach out.